So thank you everyone for the introduction. And it was great that you see the geographic distribution that this effort has reached from Fort Lauderdale all the way down to Perrine and Homestead. So our goal in by reaching out to so many churches over so many areas that we will spread the message and increase our protection of our community. Our program involves, and I'll just go to the goals here. I can never get this thing to, okay. So our goals, as we see, it's about providing COVID-19 prevention information and providing access to testing and vaccinations for the youth and the adults. We also want people to learn what makes people not do as well with this infection. And so the more we understand the diseases that's involved, the more we're hoping we can protect people. We want to especially work with the youth in your churches, and we'll go through that program that we've devised, and we want your input to get the youths involved so they too can educate others. And we want you, one of the key areas that we do in our program is that we have the RNs. You heard three RNs were introduced. We come with the Black Nurses Association, the Haitian American Nurses Association, and the Black Doctors Association. So with that, when you get any testing or vaccines from our Keeping the Faith site, we'll give you an access to a nurse to talk about those questions. You get a little pain, a little scare, and you don't have a doctor, you can call the Keeping the Faith nurse. We are bringing to the community a trusted voice so that your community members can feel comfortable knowing they're getting the truth from any of the Keeping the Faith participants and the team that you just met about coronavirus. We also want to assist the churches in how to reopen. And in a little while, Phyllis Rhymes Johnson will go through the CDC guidelines, and we'll also try and give supplies, some supplies to help the churches get going. So how are we going to do this? You just met the team, and each of the churches will have one community health worker assigned to you. And that either be Mr. Bose or Pastor Natasha, or you will often hear from Bridget. And this person is the person you can reach out to if you have any questions about the program, about where your parishioners may need some help. And so we're here to work as a team per church. We'll provide virtual education sessions. We have 6 planned, and we'll see all 6, and you'll get your flyers. You've already received your flyers. We want you to share that virtual sessions with all your congregation. It doesn't mean just the ministers have to show, but all the congregation can participate in these educational sessions. We do need the ministers for the first 3, so the ministers understand the program. And so you guys can be the trusted messengers in your church around coronavirus and what Keeping the Faith does. But have your parishioners and your members come on and learn about the nutrition, learn about diseases, learn about how to get good health care, learn what these health insurance is, all the things that made people get vulnerable to coronavirus. We're hoping this program in our sessions can help. We will provide individual sessions if your church feels that works well, and you have to make that request to us. If you think just by telephone works well and not Zoom meeting works well, if you think coming to your church or your Islamic center and doing a presentation in your congregation at that time, let us know. We need the ministers to determine what exactly you would work to reach your members. We'll provide gloves, we'll provide hand sanitizers, disinfectants, thermometers, sphygmomanometers. We'll help provide the church with a nice little kit so you can also continue the message after the program ends. We will refer you for testing. We want your churches to be a site for vaccinations. So tell us what dates, when you want us to bring it, and we'll coordinate it. The Islamic Center has already been a vaccine site for us, and they can tell you that it went very easily. We vaccinated almost 78 people at the Islamic Center, and we can do the same for your churches. You just have to give us ample notice, several days, ample notice, and we'll coordinate all the vaccines that you need. We also will coordinate testing, because even though everyone talks about what's happening with coronavirus, it's not gone, and you should get tested, especially if you're not vaccinated. You should be tested that you're negative when you're going to church. So we encourage the churches to get your members tested so they're not coming to church infected to infect others. So we will provide testing for your churches and vaccines at the churches. And we refer as much as we can to other health resources. And these are the 6 sessions that we have, the guidelines, the reopenings. We'll talk about variants and vaccines, talk about health disparities, nutrition and herbal remedies, talk about healthcare and mental health, of course. Definitely corona testing and vaccines. Everyone, we want tested and vaccinated. Now, we'll tell you why in our next talk, why we push vaccines, because we know it protects people from getting very sick, and it helps us to go back out and live safely and not have our churches be a place where you come to get infected. Because if the church is no longer the safe place for our community to come, we're going to lose a valuable resource in our community. So if people are afraid to come to church because they think they'll get infected in church, we're going to lose an important aspect of what makes our communities thrive, what makes our community be safe, what makes us love our communities. So we want you to encourage your members to be safe. Again, the on-site testing, we'll even refer for home testing and home vaccination. And we develop some gratitude prizes for each member. I don't call them incentives because we don't want to incentivize anybody to take this. This is not a bribe. When people decide to get tested and take the vaccine, it's because they have made the right decision for their health and for their families and for their communities. And we are grateful for that as a community. So we have gratitude prizes, and all the ministers on today gets a $25 gift certificate for either Red Rooster or Greenhouse Grill in Overtown. One of the requirements of our grant is that all the dollars that we spend, we try and spend it within the communities. So if you have particular vendors that you know, because we buy these gratitude prizes, and you want us to purchase things to give out as prizes for them, let Bridget know, let us know, and we will try and purchase within our communities. We chose Overtown. We want to purchase prizes from Miami Gardens. We want to purchase prizes from Liberty City, from Homestead. You have to let us know where we can purchase these gratitude prizes for keeping the faith. Your role as ministers is to encourage your members to attend these sessions. We'll give out lots of little prizes to your members also when they attend. We want the church members to really adhere to some of the preventive measures that we talk about, and encourage your members to get tested and vaccinated to stay safe. We also want your parishioners and members find a healthcare provider. Even if you're uninsured, we can help you find a healthcare provider. The Islamic Center is here. They have a free health clinic, a wonderful site in Miami Gardens. So we no longer have to say, I don't have insurance, I don't have a doctor. We can help connect you to free health centers. We can help connect you to Jackson. We can help you get the health care you need. And we'll provide even more resources. We will have some surveys because we have to prove that what we're doing works. And so we need to collect some information. Definitely, we talked about this, the supporting our gratitudes. We also know that the churches need dollars to help keep the lights on, help keep the telephones. So we're giving each church ministry, the youth ministry and the adult ministry, $250 to help in whatever you need to keep educating the members about this. Our ultimate goal is reduce the number of coronavirus in our communities. So one thing we're doing, we are trying to find more resources to bring to the churches. At FIU, there is a program called Squint. One of the big problems we have is misinformation that comes out to the community. What Squint is trying to do is finding all this misinformation, all the untruths, all the lies that you see come up on your social media, or it comes up emails. You get emails from these folks, you get WhatsApp from these folks, you get things in your Instagram, you get things on your Facebook. We have an app that we call Squint. And the app has, when you download it, you'll see a little owl that will come up on your computer, it'll come up on your phone. So whenever you're on a page where you see this misinformation, like you say, this thing, COVID-19 is real, it's man-made, it's part of a bigger plan, you would just click on this little owl, it would take a picture and send it over to a master computer, which would then collect it and send that information out to us. And then we will capture it and let people know what's happening. So this is we'll have more information on this, but what's good about this program is that for churches that are able to get their members to participate in reporting all of this misinformation, there will also be some incentives for, I think you can make up to possibly $100 a week by your different members reporting information, misinformation that you see. We know the WhatsApp comes up with lots of stuff. If your church members are able to send it to this Squint app, and they will collect how many come in from the different churches, then they will reward the churches with some incentives. So besides the $250, there are opportunities here to make at least $400 or $500 per church to be able to monitor some of the misinformation that's out there. Only if you wish to participate, but it's just another way the kids might be interested in this to get a little extra summer dollars in their pockets they're on social media anyway, so they might as well report the craziness that they're seeing. So this is another program that we'll bring. Is Jocelyn on yet? Bridget?
Dr.
Yes.
We're still working on it. We're still working on it.
Okay. Jocelyn is another service that we're bringing from FIU, because one of the things that we see are that many of our communities were in jobs that put them at risk. And we see that some folks don't want to go back to those jobs. So we're partnering with FIU to be able to bring information on jobs out to the churches. Jocelyn Cordero she's the main person that we're partnering with, who will be able to send pretty much weekly the job openings that are at FIU, because it's a great place to work. It's one of the top places to work in the state, has great benefits, and it also gives good education benefits. So if we can get more of our communities working at places like FIU, they can get better jobs that takes them out of the frontline, minimum wage frontline jobs and put them in a better position to protect themselves. So we're hoping, if she makes it on, then she'll introduce herself. Our goal really is to educate the community, set up site testing and vaccinations at your churches so it's comfortable, it's safe. Even if it's 20, 30 people we bring in, that's okay. Let your neighbors know, let your family know. Vaccines are now from 12 and up, and our kids really, we do need it. And we'll go in more as we go on. We'll get some schedule of Squint training for those churches who are interested, because you can make up to 100 a week. Definitely for members, we'll get all the supplies out to you. And one thing we do is we schedule some virtual tours, and you can see we have a YouTube channel that Natasha Brogan, Pastor Natasha, will monitor, and you can see some of the work that we've done. And I don't know if we could put that link in the chat so you see an idea of what we do to help our churches reopen safely. These are information, and you'll get it from Bridget. The last part we didn't talk about is the youth portion. And the youth portion, we've devised we hope it's easy. We want the youth ministers to determine how they want to get their kids with a youth project that we can then post on YouTube. So the youth project could be whatever innovative idea you have, which is about COVID-19 vaccines, whichever way you feel you want to vaccinate about the vaccine, about coronavirus, about how whatever idea they have, as long as it's truthful, they can present this short video, they can do a rap, they can do whatever they want. It's up to the churches and the youth group to decide. And for that, there'll be incentives. We'll have prizes for the groups that present. And we have the Student National Medical Association. They'll be your content expert. We'll have a separate session for the youth to work with the Student National Medical Association to help you create the video, create whatever thing you decide to learn more about coronavirus. And then you give that information back. There are no separate sessions for the youth, just to work with the youth to decide what you want to do. And then we'll put it in our YouTube channel, we'll put it in our Facebook page, we'll put it up on Instagram. And every church, we have, how many churches here tonight? We hope to have at least 20-something church youth groups putting information out. Plus, there are other activities for youth that brings dollars into the youth for the summer. Any questions before we go on to Dr. Rhines Johnson?
Okay, again, my name is Phyllis. I am a nurse practitioner, the coordinator for Keeping the Faith, and also I am the parliamentarian for the Black Nurses Association, and I am a member of Trinity Church who has recently joined Phase 2. Congrats, Trinity. And I work closely with Daisy, who is my health ministry leader, and Miss Andrea Fletcher with the Faith and Wellness group. I'm also a member of that initiative. Today, we're going to talk about the CDC guidelines and the new CDC guidelines. Now, all of our churches are not open, but those that are open, that have and whose congregation is fully, and again, I repeat, fully immunized, fully vaccinated, they can have an open church. They do not need, they can have this capacity that they had pre-COVID. And this is what Keeping the Faith is trying to help our churches to all to agree to. Can everyone see the slides? Bridget?
Yes, we can see
Okay,
it.
thank you. With this presentation, at the end, you should be able to list at least 3 activities why it's important to be fully vaccinated in your congregation. Discuss the restrictions of the church choir. There has been a change now with the new guidelines. Discuss the precautions required with fully vaccinated and non-vaccinated members in the congregation, and explain the significance of COVID testing and COVID vaccinations, which Dr. Holder referred to. Now, again, we know millions of individuals belong to some type of worship, and that's an essential part of their life. And COVID prevented all of us from worshiping the way that we were comfortable worshiping. We had to adapt and make changes. Instead of everyone in church, when I go to church, everyone want to hug you, kiss you, but we could not do that with COVID, which was a problem for some of us. Now, with the CDC guidelines, we need to understand that the First Amendment of the US Constitution will not be infringed on. The CDC guidelines should not and will not infringe on the rights of the First Amendment for the church, nor infringe on the rights of the Religious Freedom Restoration Act of 1933. We all know that this virus started in 2019. It really affected us in 2020. And after we started getting the vaccine, we were doing the testing, we have the vaccine, our churches are now starting to open up. Now, not only are we to adhere to the guidelines for the CDC, Center for Disease Control, we also must adhere to our local and state authority guidelines. The churches must protect their staff, protect the parishioners, and also, if your faith-based organization provides social services in the facility, like we do at Trinity, we need to make sure that we adhere to the CDC guidelines for that activity. Now, whether you are fully vaccinated or not, we all must maintain Good hand hygiene. Wash your hands for at least 20 seconds. Make sure you have hand sanitizers, at least 60% alcohol. Maintain supplies to adhere to or maintain a good um, healthy hygiene. If anyone has an upper respiratory infection, I would recommend at this time in this environment, have them to, if anyone is ill, have them to go back home. Or if anyone needs a tissue, if they have a sneeze while they're in church, make sure that there is a tissue so that they can cough or sneeze into and dispose of it appropriately. Make sure that there is hand sanitizers so that after each time you cough in your elbow, cough in a tissue, that you use your hand sanitizers, because we do not want to spread any viruses, any bacteria to our parishioners. Now with the new CDC guidelines, hallelujah, we can start, if you are fully immunized, vaccinated, you can start hugging according to our new CDC guidelines. You can hug, you can shake hands. I would recommend keeping your mask on throughout the service, because you don't know who may not be unvaccinated. But the CDC guidelines, when they talks about those fully vaccinated, they indicate that it is okay if you do not wear a mask around someone that's not vaccinated. I will repeat that. According to the CDC guidelines, you do not, if you are in a group with someone that is not vaccinated and you are fully vaccinated, you do not wear your mask. Now, you need to adhere to the guidelines of your church, but I would strongly recommend while you're in church, but again, the guidelines of the church supersedes what my recommendation, that you would wear a mask, because you do not know who is sitting next to you. They may be unvaccinated, but you are okay according to our CDC and according to the science. You are okay, and you will not get ill because you are fully vaccinated. And when are you fully vaccinated? That is at least 2 weeks after you've had either the Pfizer or the Moderna vaccine, or 2 weeks after the Johnson & Johnson vaccine. Another new guideline that the CDC has.
Phyllis, just it's after you've had the second vaccine. You got to have 2 vaccines.
After the second vaccine,
2 weeks after the second vaccine.
Correct. 2 weeks after the second vaccine. Thank you, Dr. Holder. I did not state that. I did not clarify that. It is 2 weeks after the second vaccine, you are fully immunized, and you can do all of the things that you did not do previously. Singing is another new activity that we can enjoy in our churches. We can praise, we can worship, and if our choir is fully immunized, that means they've had both vaccines, both inoculations, if it's Pfizer or Moderna, or the one Johnson & Johnson, and it's 2 weeks after the second vaccine for Moderna or Pfizer, and 2 weeks after the Johnson & Johnson, our choir does not need to wear a mask in order to sing. And hallelujah to that. Okay. Now, we all know about the 6 feet distancing, and if we have a cough, to use a tissue and dispose of it. Now, these are some activities that the CDC has stated, and as you can see, those that are who's on the slideshow? Those that are, just a minute, those that are fully vaccinated versus those that are not. As you see, and I need you to look down at where it says indoor, when it talks about 1, 2, 3, 4, the fifth line from the indoor, it says, if you are fully vaccinated, according to the CDC, you can attend a full capacity worship service. You can sing in an indoor choir. Now, those are changes. Those are new changes that have occurred. These are new CDC guidelines. But again, as Dr. Holder has stated, and as I would recommend, when you go to church, and most churches, we open up our doors to everyone. So you don't know who's walking in if they're vaccinated or not. So to be safe, you can wear a mask, but if you do not wear a mask, as long as your church is okay with that, the CDC says that you should be fine, according to the science. Anything else, Dr. Holder?
Oh, and the basic understanding of this, these are healthy, vaccinated people.
Correct.
So if you have some sort of lupus or rheumatoid arthritis or diabetes, or you're definitely elderly, you're not considered to be, when we say very old, like 70s, 80s, 90s, you're not in that category, and you should definitely be more careful with people who you know are not vaccinated. If you're vaccinated, that's why we're pushing the churches, get everybody vaccinated so everybody's comfortable together.
Correct. Now, with the coronavirus, there are a lot of misconceptions, and you have this app that is part of the Keeping the Faith family, that if your church participates in it, not only do they get a gift for sending this information to Squirt, but also they become educated, because we as an organization and as a community are trying to squash old wives' tales or miscommunications. Now, there is one misconception that someone told me, that, oh, people have natural immunity to coronavirus. No, we do not. We do not have a natural immunity to the coronavirus. Now, some individuals, once they are infected, and by God's grace, that they're able to get well from after the virus and be healthy, some people may develop antibodies, but everybody does not develop antibodies. And at this point, we don't know how long that those antibodies remain. So we are recommending, even if you have had COVID, once you are COVID-free, you have no symptoms, and at least 10 days after your last symptom, or 10 days, or you've tested negative, please get the vaccine. Approved vaccines, we already talked about: Pfizer, Moderna, and Johnson & Johnson. We know we have full immunization after the second dose for the Pfizer and Moderna, and 2 weeks after the second dose, and 2 weeks after the Johnson & Johnson. If you're fully vaccinated, according to the CDC, the new guidelines, you don't need to wear a mask. But again, as Dr. Holder has said, and like for me, myself, I have lupus. So that's why I'm careful. So you guys may see me come to church with my gloves on, with a mask on, and my face shield, because I'm protecting Phyllis. But others that are healthy, as Dr. Holder said, do not need to wear a mask if they choose not to. But if your church mandates that you can sit close together, whether you're family or not, but you should wear a mask, then that is what you should adhere to. The exceptions are in the buses, hospitals, and I went to the dentist today, and in the dental offices, I'm fully vaccinated. They asked me if I was fully vaccinated, but I still had to wear my mask. As of May 20th, there was like approximately 47% of the population had at least the first dose, and only 37% roughly was fully vaccinated. So we have a long way to go in our area and in our state. Now, when we talk about cleaning, there have been some changes with disinfecting. Now with the new CDC guidelines, if your congregation, they're fully immunized and no one is ill, according to the new CDC guidelines, you can clean that area daily, unless it is like a high traffic area, like if it's the doorknobs or if someone goes into the bathroom, um, or kids are around, it should be cleaned more frequently. But otherwise, instead of cleaning after every service and in between services, according to the new CDC guidelines, you can clean only one time, once a day, and that should be sufficient according to um, you should wash it first with soap and water, and that helps to remove the germs. And then you use the disinfectant. And we offer ZEP in our packet that we give the churches, or you can use any environmental protection agency, whatever solution that they have that you prefer, if it's not ZEP. We also, in our packet, will give you masks and we will give you gloves, because when you use your disinfectant to clean your churches, you need to wear your mask so that you don't be overcome by the vapors of the disinfectant, and also gloves so you don't have any local reaction to your skin from the disinfectant. I've talked about how to clean first and disinfectant and disinfect. You need to make sure that you read the directions of whatever disinfectant that you use. You need to follow the contact time that it states. Make sure you wear gloves and wash your hands and lock it up, because to make sure that the kids in the church do not accidentally think it's some Kool-Aid or something that they can drink and become ill. Also, unexpired household bleach has been effective against killing the coronaviruses on surfaces. Also, it's recommended that you keep the poison control hotline available in your church and visible, so that if anyone inadvertently ingests the toxic solutions, you can call poison control immediately. We need to continue. Now, this has not changed. You need to ensure that the ventilation systems operate appropriately in your church. And also, all of our churches have not opened up. What the CDC recommends is that if your church has not opened up, before you allow any parishioners in, that church must be thoroughly cleaned. It needs to be assessed for any mold. The water has been shut down. So that water supply, you can either have a disinfectant hygienist to come in, or the CDC has tools and resources for the churches on their website that will help them to take care of, to open up their water fountains safely, because water sitting stagnant for long periods of time have Legionella, and also mold. And you don't want your parishioners to drink from an infected water source. In addition to the water source, the CDC recommends that your HVAC with your AC is on and working at full force for at least 48 to 72 hours before your church opens up. Now, this is for those churches that have not opened up and are planning to open. These are the recommendations. In closing, we need to make sure we follow our state and local guidelines in addition to the CDC. And I need to retract. When I talked about cleaning the churches on a daily basis. That is a new guideline. If your church is fully, if your church, the individuals are vaccinated completely. But if someone is sick, becomes sick while they're in church, the CDC recommends that area be cleansed, and that the frequency of cleaning increases if anyone is ill or becomes ill in your sanctuary. Again, I thank you. If there are not any other questions, you can contact Miss Bridget Sewell. She is our assistant administrator. This is her number. Also in the chat, I put the number for the nurse, the hotline for the nurse, if anyone needs to speak to the nurse, or if anyone needs to get in contact with Dr. Holder, you can either contact the nurse or contact Miss Sewell. Thank you. And
Thank you, Phyllis.
are there any